Implementing bedside reporting into practice. Relevance to practice. Bedside report is one of the most vital components for the nurse foundation of patient information. It is where the exchange of information takes place between nurses on a patient's diagnosis, history, procedures performed, hemodynamic trends, medications, and the patient's plan of care. Bedside reporting enhances client and nurse relationships and improves satisfaction. Bedside reporting incorporates a visual inspection of the patient and increases nurses' accountability while decreasing the potential for mistakes. When bedside reporting is not implemented, it will lead to nurse confusion, nurse unawareness, and potential medical problems that are unaddressed. Breakdown in communication was identified as the root cause in more than 65% of 3,000 sentinel events analyzed by the Joint Commission. Bedside shift report improves client satisfaction. Clients are more satisfied when nurses get report with them in attendance because they feel included in their care decisions. Their family can get important updates and feel involved with the patient's plan of care. Bedside report increases the accuracy of the report as nurses ask questions to clarify issues with the ongoing nurse. Bedside report also allows the incoming nurse to visualize the patient and prioritize care, while seeing the patient also prompts the outgoing nurse to recall information. Bedside report also allows for discharge planning to begin earlier and improve standards of care. When nurses can visualize and involve a patient into their care, they can see their strengths and weaknesses and can reference information from the other nurse regarding that patient's progression. Bedside shift report improves nurses' satisfaction. Despite the perception that report took longer, many nurses commented that the extra time was worth it because they recognized the value of bedside reporting for patient care. Bedside reporting was associated with decreased fall rates, and this finding is consistent with the literature. When bedside reporting was implemented in a 532-bed acute care hospital over a 4-month period, patients' falls were reduced, and nursing satisfaction scores have increased. After the implementation of bedside reporting, patients' falls were reduced by 24%, and nurse satisfaction went up from 87% to 91%. A decrease in report time, nurse overtime, and patient falls was found by Othwell and co-authors after a unit staff changed from a verbal report in a conference room to a combination of a detailed one-page written report and bedside reporting. The report time decreased from approximately 40 minutes to 10 minutes, and savings of $8,000 were incurred in 2 months due to the reduction in overtime. Bedside shift report improves communication. Although it can occur at any time during client care, the greatest risk for miscommunication is during shift handover. Among licensed staff, survey results indicated bedside report prompted increased accountability and caused improvements in passing information, relationships between shifts, accuracy of report, and the amount of pertinent information conveyed. The patient survey found improvements in patient satisfaction regarding being kept informed, how well staff work together to care for them, and the perception of the staff effort to keep patients informed and involved. The nursing diagnosis for this unit is 1. Staff lack of knowledge about the benefits of bedside reporting as evidenced by noncompliance with performing bedside report and by the nurse's vague perceptions of the bedside report process. 2. Noncompliance with bedside reporting at all units of the hospital as evidenced by unwitnessed bedside reporting occurring between nurses at the end or beginning of shift. The goals of the implementation plan involving bedside reporting is to implement bedside reporting on all units of the hospital during all shift changes, even during staff changes, to increase patient and family satisfaction, to increase nursing satisfaction, to decrease patient falls related to communication, to decrease medication errors related to communication, to ensure safe handoffs between nursing during shift and staff changes. The expected outcomes of implementing bedside reporting bedside reporting will occur in all units of the hospital. Bedside reporting will promote patient safety and quality. Bedside reporting will increase nurse-to-patient relationships. Bedside reporting will promote time management and accountability between nurses. The first intervention of implementing bedside reporting will be to create an implementation plan titled Promoting Patient Safety with Bedside Reporting. The nursing leader or charge nurse will implement mandatory bedside reporting. Major threats to successful implementation and sustainability of nurse bedside report include inconsistency with new interventions, lack of leadership or employee buy-in, lack of continuous process management practices, and negative nursing feedback and emotions. The sort of leadership style that is best suited when putting a new change into practice would be transformational leadership, because this sort of leadership promotes democratic relationships that are built on mutual respect. This leadership negates personal power and exemplifies extroverted personality traits, likability, and openness. They remain highly visible to clinical nurses and are responsive to their needs. Transformational leadership style is influenced in the healthcare setting because this leadership has been shown to have a positive impact on health services outcomes, such as quality of care, patient safety, and patient and family experiences. The second intervention of bedside reporting will be to assemble a group of nurses who are aware of the efficiency of bedside reporting, to encourage each other, create a unit council to give examples of correct bedside reporting, give presentations, and even look up evidence to support the policy. The leadership theory that would be best suited for nurses to engage and encourage the implementation of bedside reporting would be visible leadership. Visible leadership requires the leaders to have an open door policy and motivation to establish trusting and transparent relationships with the nurses that are supervised. The third intervention of bedside reporting would be to find or generate a cohesive reporting template that all nurses can agree on that can be standardized into policy. The reporting sheet will be utilized during report or handed off with any pertinent information the nurse may not want to state at the bedside. This includes things that the patients may not want to talk about and includes things that may make the patient feel uncomfortable, so you can save that to hand to the nurse and then just discuss the other pertinent things that are applicable to that patient. The leadership theory most equitable for the development of a template to utilize as the cohesion with bedside reporting is implemented would include participative leadership. Participative leadership, also called democratic leadership, is a leadership style in which the team members participate in the decision-making process, which allows them to be more engaged in the management process, more committed to goals, and more motivated to work efficiently. If the nurses collectively agree on a reporting sheet, they will be more inclined to use this daily, in addition to their bedside reporting. The fourth intervention of bedside reporting would be to create a checklist that nurses can utilize to make sure they are covering all important concepts during bedside report. Checklists have been utilized more often in the nursing profession as they improve patient safety, quality outcomes, reduce patient harm, and eliminate medical errors. Checklists used in the medical setting can promote process improvement and increase patient safety. The last intervention of bedside reporting will be the engagement of walking rounds during the end and beginning of shift by nursing leaders to make sure that staff is implementing bedside reporting while offering support and encouragement. Also, having informal meetings with nurses to gain feedback, discusses any concerns or ideas for the bedside reporting process, and any suggestions that they would like to make. The leadership theory that can be utilized during the role of consistent practice and nurse feedback is transformational leadership. Transformational leadership is viewed as the most effective model of leadership because while it recognizes the importance of rewards, it goes further to satisfy the higher needs of the follower by engaging this person emotionally and intellectually. By offering the staff support and encouragement and even partaking in walking rounds themselves with other nurse leaders will support empowerment, self-efficacy, and lead positive examples to the staff. Bedside reporting. Measurable outcomes. The number of This is a little chart that I found online. This is one of the references pages. This is the continuation of my reference